Hey there, and welcome. I am so incredibly glad you're joining me for today's explainer on a medication and hormone that is literally the centerpiece of so much of female health. We are talking about progesterone. Today, we're focusing on empowering you through really clear, actionable pharmacological knowledge. Because whether you're exploring hormone therapy, navigating the complexities of fertility treatments, or honestly just wanting to understand your own biology a little bit better, this explainer is designed to give you the facts straight from the clinical data. So here's a quick look at our agenda for today. 1. What is progesterone? 2. Primary uses and benefits. 3. Dosages and administration. 4. Managing side effects. 5. Warnings and contraindications. And 6. Crucial drug interactions. Let's just dive right in, shall we? All right, section 1. One is progesterone. You'll often hear it called the hormone of pregnancy, but let's unpack what that actually means on a physiological level. At its core, progesterone is an endogenous steroid hormone. Now, endogenous is really just a fancy medical way of saying your body makes it naturally, primarily right in the ovaries, right after you ovulate. Its foundational job is to regulate your menstrual cycle and, crucially, to prepare your uterine lining, also known as the endometrium, for a fertilized egg to implant and grow. And if pregnancy does occur, progesterone is the protector of that pregnancy. What's absolutely wild to think about is that medicine has been harnessing the power of this hormone for almost a century. It was actually first prescribed way back in 1934. And that long history brings us to a massive distinction in the medical literature that you absolutely need to know about: bioidentical progesterone versus synthetic progestins. Bioidentical progesterone, like the brand name Prometrium, is a natural micronized formulation. It has the exact same molecular structure as the hormone your own body makes. Synthetic progestins, on the flip side, are man-made analogs. Now, why does this matter? Well, because they carry entirely different safety profiles, risks, and benefits. It's a really big deal, especially when we talk about hormone replacement therapy, which you'll see as we get further into the explainer. Moving on to section 2, primary uses and benefits. Basically, why exactly do doctors prescribe it in the first place? The truth is, progesterone therapy is incredibly versatile. For instance, for women undergoing menopausal hormone therapy, or MHT, taking estrogen all by itself can dangerously thicken the uterine lining. So progesterone steps in to act as a protector against estrogen's proliferative effects. It keeps the lining safe and helps mitigate cancer risks. We also use it for secondary amenorrhea, which is when regular periods just stop in non-pregnant women. Giving a targeted hormone pulse of progesterone actually induces the shedding of that lining. And of course, in assisted reproductive technology, or ART, it is absolutely vital for supporting embryo implantation. In fact, if you are a fertility patient, the number 120 is everything. In IVF, specifically during a frozen embryo transfer, your body might not have a natural corpus luteum, which is the ovarian cyst that usually pumps out progesterone. So timing becomes absolutely critical. For embryos that have developed for 5 days, known as blastocysts, clinical guidelines emphasize a super strict 120-hour window for starting exogenous progesterone before the transfer. To put that in perspective, that's exactly 5 days. This perfectly synchronizes the uterine window of implantation to give that little embryo the absolute best possible chance to attach. All right, section 3, dosages and administration. Let's look at the different routes and regimens. As you might guess, standard regimens vary significantly depending on the route. Oral capsules, usually between 100 to 400 milligrams daily, are super common for menopause and amenorrhea. Vaginal inserts or gels, which run around 90 to 100 milligrams once or twice a day, completely bypass liver metabolism and are heavily used in fertility protocols to deliver the hormone directly where it's needed most. Then we have intramuscular injections. These are highly effective for severe amenorrhea when you need to quickly stabilize the endometrium. Oh, and here is a very important clinical pearl for menopausal hormone therapy. Your progesterone dose absolutely must always be proportionate to your estrogen dose. So if your doctor increases your estrogen, they have to increase your progesterone too, to make sure you're getting adequate uterine protection. Okay, and here is a highly actionable tip for anyone taking oral capsules. As a rule of thumb, take them on an empty stomach right at bedtime. Why? Well, taking them with food actually increases how much is absorbed into your bloodstream, which can really spike your side effects. Plus, because oral progesterone often causes drowsiness and dizziness, taking it right before bed means you sleep right through all of that. It literally turns a potential daytime grogginess issue into a helpful sleep aid. Which is a perfect transition into section 4, managing side effects. Let's talk about what you can expect physically.
Common side effects can include dizziness or drowsiness, breast tenderness, abdominal bloating or cramps, mood swings, and sometimes breakthrough bleeding or spotting. Now, how you experience these often depends on how you're taking the medication. Like we just talked about, oral administration primarily causes central nervous system symptoms, that's your dizziness and drowsiness. Vaginal use, on the other hand, is much more likely to cause local irritation or discharge. These are generally totally manageable, but keeping an open line of communication with your provider is key if they start to bother you.
Section 5, Warnings and Contraindications. We really need to cover these critical safety alerts. I want you to listen closely to this one because it is a vital, potentially life-saving warning. The brand name Prometrium oral capsules contain peanut oil. I'll say that again, peanut oil. If you have a peanut allergy, you must strictly avoid Prometrium. It is absolutely contraindicated. Always confirm the absence of a peanut allergy before taking this specific brand, and be sure to ask your doctor or pharmacist for a generic alternative or maybe a vaginal formulation that does not contain peanut oil. Now, if you're researching this, you will also likely see some scary boxed warnings regarding blood clots, dementia, and breast cancer. These largely stem from the Historical Women's Health Initiative, or WHI studies, but context is everything here. It's really important to know that those specific studies largely used estrogen combined with a synthetic progestin. Current clinical guidelines suggest that natural, micronized bioidentical progesterone may actually carry a lower risk for things like breast cancer compared to those synthetic versions. That being said, anyone with a history of blood clots, liver disease, or breast cancer should generally avoid progesterone therapy altogether, just to be safe. And finally, Section 6, Crucial Drug Interactions, specifically managing the CYP3A4 enzyme. I want you to think of your liver's CYP3A4 enzyme like a giant pharmaceutical seesaw. Because progesterone relies heavily on this exact enzyme to be broken down, other medications can severely interfere. Enzyme inhibitors, like the antifungal ketoconazole, block the enzyme. What happens then? You get higher than intended serum levels of progesterone floating around in your blood, which can cause dangerous toxicity and extreme sedation. On the flip side of the seesaw, enzyme inducers, like certain seizure medications or even the common herbal supplement St. John's wort, speed up the metabolism of progesterone. This means your body clears it out too fast, rendering your progesterone treatment completely ineffective. And that is a huge risk if you're relying on it to protect your uterine lining or maintain a pregnancy. And the interactions don't stop there. Progesterone also impacts your broader endocrine and metabolic systems. For example, if you take anti-diabetics like insulin, progesterone can actually increase your insulin resistance, leading to hyperglycemia, so you might need to adjust your anti-diabetic doses. If you're on thyroid medication like levothyroxine, progesterone can reduce the availability of your active thyroid hormones, so you'll want to separate those doses by about 4 hours and make sure to get your levels checked. And if you take blood thinners like warfarin, progesterone can alter your clotting, which means you'll need much more frequent INR monitoring. The takeaway here? Always give your doctor a complete, exhaustive list of everything you take, including supplements. So armed with this deeper understanding of what progesterone actually does, how to dose it effectively, and how to safely navigate its side effects and interactions, you are now completely equipped to be an empowered advocate for your own health. But it leaves us with a really fascinating, larger question to consider. As medical science continues to uncover the profound differences between synthetic and bioidentical hormones, how might highly personalized hormone therapies reshape the entire future of female medicine? Thank you so much for learning with me today. Definitely take these insights directly to your next medical appointment, and I will see you next time.